How does LPR cause vocal cord irritation? Imagine your voice box, the vocal cords, as delicate strips of tissue that help you speak and sing. Now picture stomach contents sneaking up into your throat and larynx. That's what happens in laryngopharyngeal reflux, or LPR. It's a type of acid reflux where stomach acid, pepsin, and bile salts flow back into the upper airway instead of staying in the stomach. And like acid reflux that mainly affects the esophagus, LPR reaches the voice box and throat area. This is why it can cause irritation in the vocal cords, even if you don't feel heartburn or indigestion. The lining of the vocal cords is very thin and sensitive. Normally, it acts like a protective shield against irritants. But in LPR, the refluxate, which is the mixture of acid, pepsin, and bile, directly contacts these tissues. Acid can burn and inflame the delicate epithelial cells that cover the vocal cords. Pepsin, an enzyme from the stomach, remains active in the throat and can break down proteins in the tissue, making inflammation worse. Bile salts, which are produced by the liver and stored in the gallbladder, can also damage the tissue when they reflux into the throat. This chemical injury causes swelling, known as vocal edema, and can lead to the formation of small lesions like contact ulcers or granulomas. These injuries make the vocal cords less flexible and more prone to irritation. Besides direct damage, LPR can cause reflex responses. When the refluxate touches the throat and voice box, it stimulates sensory nerves. This triggers a reflex that causes coughing, throat clearing, and even bronchoconstriction. These repeated actions can further irritate and inflame the vocal cords. People with LP often notice hoarseness, a feeling of a lump in the throat, sore throat, or voice changes. Sometimes, the irritation can lead to the development of vocal cord polyps, which are growths caused by ongoing inflammation. Factors like eating spicy or fatty foods, drinking caffeine or alcohol, being overweight, or experiencing stress can worsen LPR and its effects on the vocal cords. Managing LPR involves lifestyle changes such as avoiding trigger foods, losing weight, and not wearing tight clothing that increases abdominal pressure. Medical treatments like acid-suppressing medications can help reduce the amount of acid and enzymes refluxed into the throat. In short, LPR causes vocal cord irritation mainly through the direct chemical injury from stomach contents and the reflex actions that follow, leading to inflammation, swelling, and tissue damage. That's why many people with LP experience voice problems and throat discomfort even if they don't have typical heartburn symptoms.